challenge that is. Good to see you here. This is our fifth meeting of the Senate Standing Committee on Health Services. Ask everyone to make sure that your phones are silenced. We have a relatively short agenda today. We'll start with the roll call. Becky, if you would, please.
Senator Rocky Adams. Senator Berg. Senator Carroll.
Here.
Senator Douglas.
Present.
Senator Herron. Senator Mills. Senator Nemes.
Present.
Senator Rawlings. Senator Titchener. Vice Chair Richardson.
Here.
Chairman Meredith.
Present. Again, we do have a quorum and duly constituted to conduct business here. Our first bill on the agenda is House Bill 303. And Representative Bratcher is here. This is a bill that we heard in the interim, and I'm looking forward to the presentation today. If you would, please identify yourself for the record and proceed.
Representative Steve Bratcher, the 25th District, Elizabethtown area.
Please proceed.
So, House Bill 303 is a bill that allows people that have been serving in the military, regardless of what branch, and have been trained in a medical field to be able to transition that education and that training over to a credential in the state. So, for example, an Air Force medic would be equivalent to and can take the exam, set for the state exam for an LPN license now without any additional training. So the schools, KCTCS, as well as the four-year institutions, this will allow them to evaluate each person's curriculum that's coming out of the military and establish or recognize the gaps. And these gaps will be able to be filled in with either classes or clinical time in order to reach to that certification and be able to take the exam quicker than having to start over again. This does not exclude or leave out any exams or requirements for testing. They still have to meet those standards. So, and this is just not for nursing. This is for any medical area. So it'd be optometrist assistant, dental hygienist, any type, phlebotomist, any type of those medical fields. So with that, if you all have any questions, I'll be happy to entertain.
Motion and second. Any questions? Yes, ma'am. Please.
Thank you. Thank you for bringing this bill. I know it's important that we try to create reciprocity so we can have more professionals serving in our Commonwealth. Will there be any type of comparison as far as what those credentials are or the trainings that individuals have done in other states, like compared to what our credentials are or requirements?
We do have some collaboration agreements with other states that can bridge over, but for our state, all the credentials and all the training and background that this person have will be based on an individual basis. So even though they may have a crosswalk that says, okay, if you were an Air Force medic, then these are the credits or the classes that would count for it, and then the gap is this. You need these 4 classes and this much clinical time to complete to be able to sit for the exam. So even though you may have a layout or what we call a crosswalk, but at the college level, to compare their experience, some of them have more experience or less experience than others. So an Army medic may have more field time as a medic, but doesn't have the clinical time, where an Air Force medic may have more clinical time. So each individual it'll be on an individual basis is what will be evaluated.
Thank you.
Thank you, former representative, but now senator.
Senator Douglas.
Thank you, Mr. Chairman. Does this primarily or exclusively include our military people and not those who have patrioted to our country?
This is primarily the people that have served in the U.S. military.
Okay, thank you.
So, and it.
Yeah, thank you.
Any other questions, comments? Seeing none, Becky, please call the roll.
Senator Rocky Adams. Senator Berg. Senator Carroll.
Aye.
Senator Douglas.
Aye.
Senator Herron. Senator Mills. Senator Nemes.
Mr. Chair, Can I explain my vote?
Yes, please.
I'm an aye because this does two things. It helps our workforce and the military. It can't be greater than that. Thank you for bringing it. Aye.
Senator Rawlings. Senator Richardson.
Aye.
Senator Titchener. Chairman Meredith.
Aye. Motion carries. 11 yeses, no nos. Passive favorable expression. Congratulations. Thanks for bringing the bill forward. Next bill we'll hear is House Bill 305. Representative Ken Fleming, who's waiting patiently in the wings. Good morning.
Good morning, Mr. Chairman.
How are you?
Fine, sir. How y'all doing?
Another day in paradise.
There you go. Living the dream.
Yeah.
Make sure
every
that phone's
day.
off.
If you would, please identify yourself for the record.
Ken Fleming. I represent the 48th District in Jefferson, Oldham County.
Glad to have you here this morning. We do have a committee sub. Motion second on the sub. All in favor say aye.
Aye.
Any opposition? Seeing none, please proceed.
Thank you, Mr.
Representative
Chairman. Thank you, committees. There's a couple of things in this committee sub. The first one, if you recall, House Bill 200 we passed a couple years ago, and we funded this past budget cycle that funded healthcare workers, and it covered a broad spectrum. And through the award process over the past year, CPE has asked that we expand that to include dietitians and physician assistants. So that's one thing we want to do. Is there's a lot of demand for that. So they want to include that in terms of having coverage for the awards and so forth. The other provisions, there is from the going back a couple of years, House Bill 777. Some of y'all might recall that it was an EMS type of bill to help out hospitals to transfer their patients and clients between facilities and so forth. And so what this basically does is basically there is a interpretation in the law. It says that owned by hospital. We want to make sure it's owned or operated by a hospital. In other words, they can have an entity that would be a contractor for the hospital in order to provide that service. So that's the other that's another change they're looking at. They wanted to do, and also when it comes to the issuing license and so forth, there seems to be a sort of a hang up in terms of once a CON or certificate of need is issued, there is a time they have to get licensed, and there is a time restriction on that of the 6 months. That's a regulatory applied by K-Beams with Kentucky Kentucky Board of Emergency Medical Services, and they want to try to give that more flexibility, have that a little more open-ended, so they can go through and get that. Those types of license. So that's what it is, Mr. Chairman, and I'll be happy to entertain any questions.
Any questions from the committee? Motion on the bills or second? Motion and a second. All those in favor vote aye. All opposed vote no. Becky, please call the roll.
Senator Rocky Adams. Senator Berg. Senator Carroll.
Aye.
Senator Douglas.
Aye.
Senator Herron. Senator Mills. Senator Nemus.
Aye.
Senator Rawlings. Senator Richardson.
Aye.
Senator Titchener. Chairman Meredith.
Aye. The vote is unanimous. House Bill 305 is amended, passes with favorable expression. We do have a title amendment that we need to act upon. Is there a motion? Motion and a second. All those in favor say aye. Any opposition? There being none, we're finished here. Congratulations. Good
Thank you
deal.
very much. Mr. Chairman, without going to consent calendar, I know you'll have a rule about if it goes unanimous or y'all do away with that rule.
We're not doing consent calendar in this committee.
Okay, I didn't. Okay.
Appreciate you asking.
Okay, I just want to say. Thank you very much, Chairman.
Let me remind everyone, our next scheduled meeting is Wednesday, March 12th, but I want to put you on notice that a lot of things are coming over from the House now. We may have to have a special call meeting next Monday, so please put that on your calendar, and we'll formalize that as we get further in the week. With that, there being no further business for this committee, we stand adjourned. I'm sorry, buddy.